One of the things that we've implemented in Montgomery County in anticipation of the surge, one of many things actually, but we've developed these EMS Strike Teams. And basically what that does is partner up a EMT and a paramedic, and they are in SUVs, sports utility vehicles essentially, and they're deployed throughout the county. The number of units that we have available will fluctuate, so we've just begun this process, but the intent is to provide another option for a patient. We don't necessarily, in many cases, they don't necessarily have to go to the emergency room, but previously the state protocol was if you called 911 and we responded, you could either refuse transport or we were going to take you to the hospital. Now the state did develop a new protocol and was approved by our medical director here in Montgomery County, where a clinician, in this case a paramedic, can come out to a home, assess the situation, evaluate the criteria, the symptoms and so forth, and maybe provide the best treatment going forward is for that patient to stay in their home, the comfort of their home. And, we'll give them some guidelines, some information to follow. Certainly, if they have developed symptoms that become worse, trouble breathing or elevated fever, we want them to call 911. And, it all starts with the call to 911. In fact, as part of this new protocol, the call taker will ask a series of questions. We're going to ask questions anyway, like what's the emergency, what's your address, phone number, things like that. But there's a series of questions specific to this epidemic.
Thank you so much for that, Pete. Now, do you know of any other jurisdictions that are doing something similar to this or anything of that nature?
Well, I think, this was a protocol that was developed by the Maryland Institute of Emergency Medical Services Systems. That's basically the regulatory agency that oversees our paramedics. Throughout the state, they did develop this, allows paramedics to do this, or clinicians. In our case, it's a paramedic. So again, the focus is to try to keep people out of the emergency room. We're anticipating a significant surge of people affected by the coronavirus. Obviously, we're very concerned about the surge overwhelming our healthcare system, the emergency rooms in particular. So this was a step that was developed statewide, and I imagine there's other places in the nation that are also doing something similar. But certainly, if you think you've been exposed to COVID or coronavirus, or if you have one or two of the symptoms, you should call your doctor, call your healthcare professional, get some advice from them. If you have something that you think is an emergency, elevated temperature, fever, and trouble breathing, shortness of breath, call 911. We'll go forward with the best way to serve you.